Hi, good evening. No pay talks until junior doctors drop their demand for a 35% pay increase. That's what the government said today as medical professionals walked out on strike for an unprecedented 4 days. For their part, junior doctors say they'd be prepared to suspend their action if the government put a credible offer on the table. The British Medical Association union says it wants pay restoration because junior doctors have had 15 years of below-inflation wage rises, and there's a shortage in the workforce. Health staff have been offered 5%. The battle lines have been well and truly drawn today outside hospitals across England and across the airwaves too. Tonight we want to try to move on what has now become a familiar argument. We've gathered players from all sides and in a few minutes we'll ask if there's a way forward and any common ground. First, how disruptive could this strike action be? Kate has been looking at the data.
Health Secretary Steve Barclay has previously accused unions of making a conscious decision to inflict harm on patients by going ahead with industrial action for NHS workers. The exact impact of the junior doctor strike, though, is quite difficult to quantify. In mid-March, when junior doctors from several unions last walked out, around 28,500 staff in England missed work due to strike action each day. With that constrained capacity, the NHS have made plans to prioritise emergency and critical care. Studies of previous strikes show this can be effective. The 6 days of junior doctor strikes in England in 2016 saw no statistically significant increase in deaths on those dates. Disruption, however, can be far more widespread. In March this year, English NHS trusts were asked to submit data on appointments which were rearranged as a result of industrial action. The biggest impact by far was in elective treatment. A daily average of more than 58,000 elective procedures or outpatient appointments were rescheduled due to the strike. Now, we should say that hospitals are given a certain amount of discretion in what they count as being moved due to strikes, but here we will take them at their word. Now, if that same pattern was followed for this week's longer 4-day strike, more than 230,000 appointments would be affected. And the timing will also play a role this time. The long bank holiday weekend typically sees a rise in people seeking urgent care. Think about DIY injuries as just one example. And other non-striking staff, such as experienced consultants, are more likely to have booked days off. Combining all of this is why there are predictions of 250,000 or more elective procedures and outpatient appointments impacted by this strike. That would be a larger disruption than the 6 days of junior doctor strikes in 2016, and recovering from those delays will add an extra pressure on already stretched services.
For every day you lose, you have to get a day back. And there's nearly 1.5 million people sort of referred into hospital for treatment every month. So losing the days that we're coming up to will probably take some months to catch back up, assuming there are no further, and that will require people to work harder and quite a lot of extra effort. And that's one of the things that I think is a worry, because of course, while the doctors are on strike, other people are taking the strain. And in common with a lot of other health systems in Europe, people have come out with a very high rate of sort of burnout and fatigue.
Now, when we think about the impact of these strikes, we have to remember the scale of the problems the NHS is currently wrestling with. The pandemic was the great change in waiting list for elective care. It had been growing prior in the years, but restrictions on appointments during COVID-19 saw the waiting list jump from around 4.5 million people to 7.2 million. And even if this week's 250,000 rearranged appointments translated directly to an extra 250,000 on the waiting list, which is unlikely, that would still be a drop in the ocean. Now, billions in funding has been committed to tackle the COVID backlog. In February 2022, a plan focused on the most extreme wait times. And since then, some progress has been made. Those waiting more than 2 years for treatment have fallen to around 1,000 people. Numbers waiting more than 18 months also fell. Now, waits that long were intended to be eliminated by this month, but the NHS suggests this group recently halved again to just over 20,000 people. At the same time, though, those waiting more than a year or more than 18 weeks have either remained broadly static or increased. And the areas where the NHS has made progress, well, on this graph, they're right at the bottom down here, almost invisible against the scale of the growing issue. The irony here is that to truly tackle this waiting list, which these strikes will likely increase, the NHS will need to increase capacity significantly. And that will require staff willing to take on that work, something the outcome of these strikes may determine.
Let's bring together all parties involved. Conservative peer and former Health Minister Lord Bethell is with us, as is Dr Emma Runswick, who is a junior doctor and Deputy Chair of the British Medical Association Council. Alongside me in the studio, Annie Gibbs, who's had multiple appointments cancelled since January, and Dr Layla McCay, who is Director of Policy at the NHS Confederation. That represents NHS Trust. Welcome, all of you. Annie, first of all, so 3 cancelled appointments since the beginning of the year to get a hearing aid. How are you feeling about that?
For me, it's been extremely frustrating because it's, something that I really rely on when I'm in large group settings. For work, for example, I can't engage because I find it really hard to keep up with conversation, and it's affected my confidence, because most of the time I will be in those group settings and I just won't talk, I won't say much at all. So it's affected my mental health, it's affected me going out sometimes in the evening if I'm alone, because I can't hear very well.
The first report was in January.
Yes.
3 cancelled, including one this week. Yes. The next one is, do you know when you've rescheduled one is?
Yeah, so they sent me a text message to say it's been rescheduled for the 19th of May. So that will mean I've been without hearing aid for almost 5 months, which is almost a year, half a year.
Let me bring in Dr. Emma Runswick. What Annie has described is not life or death, but it's debilitating for her. What would you want to say to her?
Yeah, absolutely. It has an impact, and many of these appointments and procedures will do. But like Annie, there are tens of thousands of people for whom this is not the first time that they've had their appointment cancelled. And why is that? It's predominantly not due to strike action. We had 7.2 million people on the waiting list before there was any strike action in the NHS, and certainly before there was junior doctors' strike action. Their appointments are being cancelled because we have a lack of staff, we have a workforce crisis. Why do we have a workforce crisis? Because we have run down pay and conditions for health workers over the course of the last decade.
But we do,
and staff are leaving.
We do. All of those, some of those things many would agree with. We do know that Annie and potentially over 250,000 other operations and appointments and procedures have been cancelled this week as a result of this latest 96 hours continuous strike action by you and other members.
Yeah, and it's really disappointing that that's had to happen, but this was entirely avoidable. We have been asking for talks with the Secretary of State since last August. We've repeatedly offered negotiations October, January, when we first started balloting. At the end of our ballot, we offered further talks, not forthcoming. We took industrial action. We had a negotiation meeting in which Steve Barclay left that negotiation meeting on the 22nd of March with nothing offered at all, having previously had no mandate. So we're in a position where we're having to call industrial action to shift the government, and the government is saying we're not prepared to talk at all. They won't even put any offer, let alone a credible offer, on the table to discuss with us.
They say if you abandon this demand of a 35% rise, then the Health Secretary will resume talks with you. Are you going to do that?
So we've put our opening position. So if you refuse to talk with a party in negotiations that's put an opening position, that's a refusal to talk. Negotiations need 2 sides to be participating, and currently we're the only side participating.
There can't be that many people who believe that a 35% pay demand is realistic. And also, you're using RPI, which is, according to the Office of National Statistics, not a credible figure to use when you're looking at inflation.
There's a reason we use RPI. It's used for our student loans. Many of us have, over 80,000 to 100,000 pounds of student loan debt. That's the measure that the government used for our student loans. It's also the measure that they use to uprate gilts. It's also the measure that they use to uprate council tax and many other costs. So if it's good enough for the Treasury in those circumstances, it's good enough for us. It also includes housing costs, which CPI does not. We are claiming 35% or pay restoration to 2008 levels because we've lost that much. We've lost 26.1% of our pay in real terms. That makes all of us poorer. It puts us at significant disadvantage compared to other countries, other English-speaking countries like Australia and New Zealand, which are very attractive to my colleagues, and many of my colleagues are moving there, worsening our workforce crisis, causing a position where many of us are carrying 2 bleeps, doing multiple people's jobs. We're not giving the care that we want to give patients. We think that can be reversed. We think that patients in this country deserve better than that. Doctors in this country deserve better than that. The numbers here are really quite small if you think about them in real terms. If you pose it as a percentage, it seems large. But doctors in this country currently earning £14.09 an hour, if their pay were restored, would be earning approximately £19 an hour. And most of your viewers would consider £19 an hour for a doctor to be perfectly reasonable. The overall cost to the government would be approximately £1 billion, a drop in the ocean compared to other government spending, even within the health budget, let alone the wider budget.
OK, let's bring in Lord Bethell, then, Conservative peer, former Health Minister. A drop in the ocean, Lord Bethell, in terms of what the junior doctors are demanding.
These 4 days of strikes are going to hit the NHS so hard. They've got no derogations for cancer, for heart units, for A&E, or for maternity. Waiting lists are going to go up. And the claim that this is in order to benefit patients is frankly ridiculous. It's a huge amount of money. Health has done well in terms of its budget compared to other departments. Secondary care has done well compared to public health and social care. And with COVID recovery, with surgical hubs and with new diagnostic centres, there's been a huge amount of investment.
Okay, so how do you...
money can be found easily. It's just not right.
Well, nobody's suggesting it's necessarily going to be found easily, but it's a choice. How is it fair that junior doctors have had below-inflation pay rises for a decade and a half?
Undoubtedly, doctors should have a pay rise. And by the way, almost everyone in this country is looking at a pay rise and a negotiation. But
Right.
not everyone in this country is going in studs first with a 4-day strike over a bank holiday weekend. This is an incredibly aggressive move, and it will hit patients really hard.
And the government is potentially pouring petrol on it by demanding the BMA abandon their opening gambit before the government says it will sit around the table again.
No, I don't think that's right. I'd remind you that there are votes on Friday with the Royal College of Nurses and with Uniton to agree the terms of negotiations that have been settled already. No, the government has a record of coming to the table and of agreeing.
Yeah, but sorry, the government did not make the demand of the nursing union, the RCN. It did not say to them, abandon your 19% claim and then we'll sit down. So why is it doing it with junior doctors?
The 35% claim from junior doctors, which you quite rightly pressed Emma on, is extremely high. It is not, I don't think, acceptable for anyone. I mean, I don't know anyone who thinks that claim is a reasonable one.
But it's
it's
an opening gambit, isn't it?
Well, I do not know the inside story of their exact negotiations. What I can see is doctors who have very good pensions to look forward to, a lot of job security, and compared to the rest of the public sector, extremely high wages indeed, behaving like a trade union and not like healthcare leaders, which is what they should be.
Aren't there smarter ways of negotiating as opposed to just stonewalling and saying, drop your demand or else we won't talk to you?
I think that there are definitely better ways of negotiating. I think the whole thing is totally heartbreaking. When I think of all the work that's gone in to put the NHS back on its feet and to see that work being wrecked by these strikes, it really makes me feel very sad indeed. It will put back the whole healthcare system for months or write off a whole year's worth of work if it continues like this. I would really call on the doctors to think again.
And what about the government to think again and get around the table if there are better ways of negotiating?
Yes, I am impatient for the government to do its best, and I think that it has been in a very difficult position. But I would just remind you that these negotiations have implications for every single public sector worker. There are consequentials for giving pay rises to doctors that touch on almost everyone who works in the public sector. So they can't move lightly on these matters. What must happen is for the focus to be on patients and to get those operations done. You rightly pointed out the 250 or 300,000 operations that will be missed just in this week. That is something the country cannot afford.
Let me bring in Dr. Layla McCay then from the NHS Confederation, which represents hospital trusts. I want to ask you, first of all, your assessment of today, what your members have said about how the trusts have been able to operate today with those who are covering for junior doctors.
Well, across the country, NHS leaders have been working incredibly hard for weeks to try to bring in the mitigations to keep things as safe as possible for patients, which is why we've seen things like these elective surgeries and appointments having to be cancelled to make that possible. And we've got consultants, we've got specialist doctors, pharmacists, nurses covering at the moment for junior doctors. And from what we hear from our members today, it has gone fairly well, but it has been very, very challenging to achieve that coverage, particularly in places where locum cover are participating in the industrial action. So really, while they're just about covering, it could be the case that somebody goes off sick and then they're in real difficulty. It is absolutely on a knife edge right now.
On a knife edge? So do you mean patient safety is on the line as the days go by?
Many of our members tell us that they are at this moment worried about patient safety and what the implications are going to be. They may have sorted out adequate cover for today, but they're not quite sure what to expect tomorrow and the next day and the day after that. So certainly this is a huge challenge to keep everything covered, keep everything safe, and members are saying they are worried.
Dr. Runswick, you've chosen this week for 96 continuous hours, the weekend after the bank holiday. Many staff are on leave for Ramadan, for Easter. I mean, that is cynical at best and dangerous at worst, surely.
It's certainly not cynical. It's the dates that we could call earliest after negotiations completely failed and broke down after our last round of action and the Wednesday negotiations that Steve Barclay walked out of without an offer. And you know, Layla is right, Dr. McCay is right that trusts and many management teams have been working extremely hard to ensure safe working. We've got a very strong joint working relationship with NHS England, a derogations procedure, both for major incidents. I've received calls this evening about a coach crash on the M4. We've agreed a derogation in Somerset. So I'm really confident that our attitudes towards safety are of healthcare leaders, as Lord Bethell describes. and as well as being that of trade unionists, because being a trade unionist is not in conflict with our commitments to patient safety as doctors.
Let me ask you finally then, Dr. Runswick, how long do you think your members have the appetite for continuing this kind of strike action if there is no movement from the government?
Well, they gave us a 98% yes vote on the back of the largest turnout in history since the Trade Union Act came in 2016. So I think my members are telling us loud and clear that we need pay restoration, we need to fix the workforce crisis so that we can get care back to the state that patients in this country really deserve.
OK. Thank you all very much. Thank you for talking to our audience on Newsnight tonight. Thank you. What can the